to Adventures in Caregiving. This is Elena. I am your host, talking about all things caregiving. So, today on the podcast, I wanted to talk a little bit about my personal experience being a caregiver and how I got in this space. As I said in my previous episode, I have a son who's 17 and he has several disabilities. And so today I wanted to take it way back, kind of talk about early childhood, talk about having a newborn with a disability. He was born, I had a normal pregnancy and everything was fine, nothing abnormal. Um, Comparing to my oldest child, I have a daughter who is almost 22 now. So when I was pregnant with my son, I just read the pregnancy books and looked at the different milestones I should have, and things were fine. He was born at full term, and we noticed maybe 2 weeks after he was born that he had a little bit of a head lag, a little delay in like holding his head up, and he just didn't feel like he had the strength to hold himself, if that makes sense. So we went to our 2 week checkup, and the doctor said, well, let's just observe. It's kind of early. We'll see you back in a couple of weeks. And we went to our monthly checkup with the pediatrician, and she referred us to a neurologist. She gave us information that was so important to me, which is what I wanted to kind of share in this episode. She gave us information about early childhood intervention. So, in the state that we were living in at that time, they had a state funded program. And I believe, don't quote me, but I believe there were some services that if you had insurance, then they would use it. But if you didn't, there were some options through the state that you can get. And I'm so grateful that she gave us this information because they not only helped with making sure that TJ was doing certain exercises and making sure that he had that early intervention, but it was also prepping me on how our life would go. So she gave us the phone number. I contacted the early childhood intervention department. I spoke with a coordinator who set up an evaluation. And the evaluation was set up just to see if we even qualified to be in the program. So there are some qualifiers, and I'm sure it varies state to state, so I won't get into particulars of that. However, in my case, because he did have some delays and the doctor could sign off and clear that, we were experiencing several delays and milestones, he qualified for services. So I'll reiterate that I'm sure each state is different in the services that you receive, but some of the services that we received was physical and occupational therapy. They have speech therapy. They have a dietitian. I believe they have like psychology. So there are an array of services that fall under that early childhood intervention. So if you were not aware that this program is available, I highly suggest that you reach out to your pediatrician, your doctor, your social worker, or if you can't get a hold of that or they don't have any information about that, I would, if I were you, I would just go online and search in your area to see if they have that. So, getting back to my story, so we did the intake. We were assigned a coordinator. They determined that we were able to get in the program, and that coordinator also let us know what services we qualified for and how many hours we were supposed to have each week. So in this process, we were first placed with physical therapists, which in later episodes I'll probably abbreviate. So if you don't know, physical therapists, their abbreviations is PT, occupational therapist is OT, speech therapy is ST, and then we had a dietitian. So originally, when we first started, TJ was about 4 months by the time we received approval and we went through all the different steps. We were assigned occupational therapy and physical therapy. So we had a therapist come to the house, and I think when he was about 8 months or so, we incorporated speech therapy into our team. And so I had my main crew, and they were with us every step of the way. We pretty much had therapy every day of the week. Um, PT would probably come out twice a week. OT would come out a couple of days a week. Speech maybe started out with once a week, and then we kind of increased. The program emphasized the importance of a family setting that's more comfortable with the child. So all of our therapies were at home. That actually worked well for us because TJ had a few complexities, so it was hard to get him and drive him to and from different therapy centers. So having them come to the house, having us be able to use some of the toys that we had, some of the items that we already had in the house, they gave us exercises that we could do and work into our family life schedule. So that was just very helpful for us. I like I said, I totally recommend that you check in your area to see if you have some concerns about your child's progress. At first, I was a little hesitant, I guess, just being a new mother and just all of this was moving so fast, and I wanted to make sure that he got the best care. So for me, it was just making sure that I had extra tools to help aid him in his progress. So that process went on week by week, and we would have a reevaluation period. I would say every 8 weeks or so to assess if we were making progress, and if we were, then what are other goals that we need to strive for. If we weren't, we would try to look at those tactics and see how we could meet our goals. There was always an annual meeting, so we would bring everyone together to talk about his plan. Everyone would give their summary of what they saw in TJ, what they think that he would benefit most from, if there was any type of equipment that needed to be ordered, or if there was something that we were seeing that maybe we could try a approach, like a dual approach where OT and PT may come at one time. I don't know if they still do that because, to be honest, we're still in therapy, and as years have gone on, co-treatment, sometimes they do it, sometimes they don't. So again, you just need to check with your team to see if that's even allowable. But back then, we were able to co-treat, so that actually worked out well for us. And just having that team that I felt comfortable with, knowing that they were putting his needs first and they were trying to help him meet his need, really made me feel at ease. Because you only go to the doctor when necessary. They'll see you every 6 months or every year or whatever. But this team is dedicated to you. It's outside of the doctor's office. It's in your home, and you just have that added set of support. So for me, it was it was the world, honestly. So, as a parent stepping into this new world, I would say it is a lot to process. Not only do you have to understand the plan itself, right? Because you're making the plan as you go, and you're making sure that you're addressing your child's needs. You also have to make sure you're working with the right team that's the best fit for your family. You may be assigned to a therapist, and for whatever reason, they may be a very good therapist, right? In certain areas, but their technique may not be working for your child, or their time and their flexibility may not work with your schedule. And it is okay to ask for a reassignment. If I can leave any gym, I would say, as far as advocating for your child, also advocate for yourself. If you know that a therapy time or the therapist you're watching and you're trying to implement things and it's just not a good fit, it's just not working, you guys aren't on the same page, or they tell you they can only meet on Wednesdays at 9 and you know that you work on a Wednesday, then it may not be the right therapist for you. And that's okay. There are other therapists within the program that you can then contact your coordinator to discuss what your needs are, and then they can help you either get assigned with a new person, or you can possibly interview a couple before you make the commitment. I just want to encourage families and let you guys know that you do have those options. That you're not stuck with just a set team. In my personal opinion, I like to advocate for what works best for my family. So I just wanted to drop that gem out there. And I also wanted to talk a little bit about some of the exercises. So with my child, like I said, we're stepping into this new world. Um, I did not realize until looking back that the early childhood intervention program was a foreshadow leading me into the meetings that I would have for school age, for preschool and school age, because we would then be assigned a team for his education and planning, right? And understanding um, what we did in early childhood intervention actually carried over when we started to talk about the individual education plan, or what most people would say the IEP at school. So that was very important. And I feel like I would have been totally lost when we would have to do an IEP meeting for services to see if he qualifies in a school setting and where he qualifies if I did not have the experience of the early childhood intervention. So back to the team. So this team, they're in your house. They're they're asking what exercises you're working on with your child. If anything new has happened, you have in my experience, I had a newborn with a growing personality, and he may not have wanted to do therapy every day. In fact, I know he didn't want to do it every day. So there were times where we had to cut sessions short, and there would be a frustrated baby and a frustrated parent because I was stepping into a world that I knew nothing about. I just knew that I wanted him to get better. I wanted him to progress, and there were days where we I just had to shut the house down. There no therapies. The first therapist came through the door in the morning. He wasn't having a good day. It looked like the day was steady going downhill. So I would have to cancel, and that is okay. I just want to affirm that for families that feel like they're just running on low fuel and there's not a way out and they just have to keep going. Sometimes it's okay to pause for a while. Sometimes your child can be sick, or you can be experiencing some family matters where you can call your coordinator and say, "Hey, I need to put a pause on all therapies for a couple of weeks. Is it a possibility I can do that? How do I go about that process? Will I lose my placement?" I would check all those different questions off before you actually commit, right? But like, just know that you have choices so that you don't feel completely burnt out. It was very frustrating for me during that time because I did have to go back to work right when we started the therapies in the home. So I was a new mother again. I was going back into the workforce. I had people in my house day in and day out. I had an extended family now, and none of my peers, none of my family, none of my friends could relate to the experiences that I was having. It was very hard for me to wrap my head around my new normal, but slowly and surely, day by day, I fell into a rhythm of it, and he has been in therapy ever since. And like I said at the beginning, he turned 17 this year. We have changed therapy so many times, but I will say through it all, early childhood intervention really helped us at the beginning. It helped me to find my voice. It helped me to realize how to navigate for my child. So, if I had any advice, I would recommend that you check with your state or your Health and Human Service Department to see if there is an early childhood intervention program that may work best for you. And now I'm going to switch gears a little bit. and talk about something that I haven't heard being talked about before, and that's dealing with grief. I dealt with a lot of grief during this process, primarily because my child wasn't hitting milestones, and the dreams and the aspirations I had for him during this time period and the things that I wanted to enjoy as a new mother and having a newborn son, I didn't get those opportunities. And I had no one to relate to. I didn't have anyone to look up to. And it was a fight, honestly, to make sure that I was coherent in speaking up for my child when it came to his medical matters, that I had the strength to continue to smile at work and do my job at work, knowing that I am in pain and I am sad, just all around sad, and not having the proper support to help me walk through these steps. It was very hard for me. Uh, it's sometimes challenging for me to talk about, and I haven't heard many people talk about that aspect of caregiving where you're the parent and you want to talk about these different things and you want to talk about these milestones and you want to do baby and me time or talk to people about your child, but they can't relate. And honestly, you can't relate to them. And so it kind of, if you let it, will put you in an isolated space, but you don't have to stay there. It's okay to have those feelings of grief and being able to process. And no one told me that it was okay to process that, to deal with it as grief, because you are grieving while also making sure that your child is getting the things that they need, right? Like, but there's a piece of you as a caregiver, that you have to acknowledge that that's the space that you're in, and you won't always be in that space. But I think that it is important to acknowledge it, and if you have to speak to someone that has the space and the capacity to hold that and to hold your hand through that process. And if you don't have that, then I would recommend looking at a support group that you could talk to about it, or to contact a therapist for yourself, just to make sure that you're getting the information, um, or you're getting the things that are on your mind out of your body and you're able to express it so that you can be the best person that you can be. You can let it go, let it out, know that you have a job at hand that you have to be strong for, and that you can express yourself while caring for your child. Two things could be true. You can be sad, and you can also be strong knowing that you are giving your child the best possible care that you can give with the knowledge that you have. I will say that it is challenging to have this responsibility and not have anyone to relate to. And I think in future episodes, I'll begin to talk about the support and how families can support you, and maybe I should talk about things, ideas or suggestions of how the family and friends of the caregiver can support by the things that they say or what not to say and how to support. I think that's a good episode that will be forthcoming. And ultimately too, how to show grace, because having this type of responsibility as a caregiver, for a young child, for a newborn, it's not for the weak. So if you are experiencing that, I am with you. I have been there, and you are doing an amazing job. You are doing the best that you can do with the information that you have, and that is to be acknowledged and commended. So I think that is all that I would say for now, but I just want to thank you for taking the time to listen. And if you have any comments or suggestions or questions, please feel free to reach out to me. I'm happy to answer any questions you may have. And until next time, take care.